mean, I guess going a little more generally, I think another thing that people talk about is, you know, diet, post-surgery diet and exercise and things like that, whether vegetarianism, an alkaline diet, etc., things that might make your body, you know, a less hospitable host for tumor cells, and whether there's anything that you think has any merit to it. Vitamin C dosing, that type of thing.
Obviously, I don't think there's any publication that points to any one thing, otherwise we'd all recommend it to everybody. One book that I have read recently that I think actually is well done is the anti-cancer book, A New Way of Life. I don't know if anybody has read that. It's an interesting story to read about a person who's been through cancer and who has a scientific background out of Pittsburgh, right?
His doctor.
Yeah, he's a
Did he have
doctor,
brain
yeah.
cancer?
He had brain, he's a neuropsychologist who had brain cancer, and he does a very nice thorough review of the literature and really only picks articles out of literature that are published in extremely good journals, Science, Nature, you know, PNAS, those sorts of things. So it's and he presents a lot of interesting, you know, thoughts about types of food and why they may or may not be good or bad, or you know, it's. So it's if you're interested in that sort of thing, I recommend, you know, that book, because I think it is well done and thoughtful. But I don't know of anything that I could, if there was something I would tell everybody, you know, eat this. This will work,
Right.
But we don't have that at this point.
Well, I think that's the thing about that anti-cancer book is, if nothing else, I think when you read it and you really focus on what he's saying in there, nothing he's recommending is going to hurt you. It's all the things that you would hear are the things you should do to be healthy anyway. So I found that very appealing because it sort of matched back up with logic of what you should be doing for yourself.
I think I told my patient one of the most post-operative orders is you must smile 6 times a day, and you increase it progressively every day. I think the attitude is very important. I mean, really, and it's all, you know, I wake in the morning and these operations, you know, at 5:30 in the morning, I'm running a few miles just to get ready for the operation. You know, otherwise, I cannot handle it. And I think the attitude is important. It doesn't matter who we are, something's going to happen to us. And at the end, I see the difference between life and death in patients just by the way, how much they want to do and how they want to live. And, you know, yeah, a surgeon, we want to focus and do the operation, but really it's more complex than that. What you put in your heart and how you want to recover and how, you know, and your family support, all that has a tremendous help. Now, you need to be active. And, you know, this is the issue that we're talking about, the quality of the life. People gain weight. You have to, you know, change your life. Yes, it happens. This is it's a big black in the road. You need to move up and move forward. And you may have a recurrence, but don't sit down and wait for your recurrence. You know, if it happens, we'll see where we can help again. If not, don't wait, because you are going to waste the time, the good time that you had ahead of you. And I think the important thing is that you really keep going. And now, good exercise, good diet, you know, all those is important. But, you know, wake up in the morning, look in your mirror, and say, God, I'm beautiful. Let's head now. You know, I mean, you know, so, no, I think it's very important, you know, the way you feel, and, you know, if you are there, oh, I feel terrible, it's another day, you're going to feel terrible, you know, and I think that's very important.
What about people that can't gain weight after surgery? What do they do?
To back up, say it before you answer that question, my brother had the surgery, resulted in complete removal of the colon, 2/3 of the small bowel, so 1/3, sorry. He has an ileostomy now. He's having terrible problems with the bag, getting adjusted to it, doesn't fit right, probably because of the way the ileostomy is positioned. That's the way they had to do it, because he had a lot of disease. Having a lot of problems with appetite and dehydration and gaining the weight. He cannot gain weight. Any suggestions on things to do to gain weight other than just eating McDonald's French fries every day?
He probably has a short bowel syndrome. It's possible. How long ago was your surgery?
October 13th.
So about 6 months now. We have people who actually take a year to regulate, and even more than that. But you may have, you know, if you have 2/3 of the bowel still there and the stomach there, you should be able to do well. But you need to put a regime that should be specifically tailored to you. There are some ways to measure why are you losing, you know, how much fat, and that can, you know, if at your institution you have someone expert on ulcerative colitis like we do at Mercy, they can help to tell us whether you have a chance to recover on this or not. But most people actually can recover. But you have to. We use a lot the tincture of opium. It's actually very good, and it can be regulated and all. But I mean, there's a program that you actually have to be on and see there are the steps that you have to be taking in order to do that. Now, it's not unusual to lose weight, gain back a little bit, and instead there never be as good as you were before.
That's what I'm doing. I gain 5 pounds, I lose 5 pounds.
And but I need to be a program. I mean, this is the thing that we're talking about, quality of life. I mean, this is issues that we need to involve other specialties because it's complex. I mean, yeah, we do a good operation, we remove all the tumor, and now how do we fix that? And there's a lot to learn. And the issue of diarrhea, it's an issue to the point that I told our ulcerative colitis person to give a whole lot of talk about diarrhea and how it's the best way to do that. There is a drug called sandostatin. The problem with sandostatin, though, is that eventually will cause pancreatic insufficiency. So you don't want to use it for a long time because then it creates a problem. If you use the another drug that we use a lot, if you lose the distal third of your small bowel, you should not be using cholestyramine, which is a drug that actually binds to bile acids, because then you deplete yourself of the bile salts that help with the. So this is actually more complex than you're telling just take this pill or this. Everybody is individualized, and if I don't get disappointed, if you have to third your bowel, most people do pretty well, and you should be able to maintain yourself.
So what kind of a doctor would he be going to?
Probably a gastroenterologist, experienced in ulcerative colitis. Those are probably the people who can help you the best.
He is still seeing the gastroenterologist oncologist at Fox Chase as well.
That is not going to help you.
It's not-
I'm sorry to say that it's not because
No, I understand.
you know, I
It's
really-
not
it's not that. It's very complex, and what it does is, I mean, I just yesterday I talked to Mary Harris, you know, she's in an institution, and I said, listen, I want you to give us a talk to, you know, me, my PAs, the students, so we all understand, because it's actually complex, and what you don't want to do is get 10 doctors managing your diarrhea, because it won't have, you know, one give you this, the other give you this, I saw this, he told you this, then it has to be a progressive management of the diarrhea, you know, killing it step by step until you get the right, to working with the dietitian at the same time to see what type of, you know, and you have to really learn yourself or how, you know, what diet really causes it and what diet, you know, what you eat that makes you go worse and what time of the day. You know, sometimes we put people on Imodium 3 times a day regardless, just to allow an advance from them. And some people, now it's not uncommon for several months if you have a lot of bowel removed that you have diarrhea. And the idea again, it's a more complex than just telling you right what to do, but it's a really, you need to be in a program to be able to do that.
And Dr. Patton had mentioned as well the role of a nutritionist during that process, which I think makes sense too.
Now, occasionally we have patients that, you know, we do the operation and, you know, it doesn't taste good, and we probably tell them, you know, the food doesn't taste good for 2 months and you don't want to eat. You know, when we start seeing that, we actually place the patients on a night TPN for 2, 3, 4 weeks, just to allow kind of the, you know, the whole system to reshape itself and get strong, and so then you don't, because otherwise it becomes a vicious cycle. You don't want to be dehydrated and your kidneys, you know, and then it becomes spiraling down.
Are there any regarding the TPN, because we're getting mixed things with that. He had surgery with Sugar Baker. We're from the Bucks County area in Pennsylvania. Sugar Baker's in Washington, D.C. Trying to manage that from there and there, it's very difficult. They want to put him on TPN. Fox Chase, again, suggested against it, saying how bad it is for you.
They were worried about if he got a blood infection or.
I mean, anything we do has complications. Anything we do can actually kill you. You know, literally. I mean, I said that. No, I mean, anything but you have to weigh the benefits and the advantage. If you are kind of going down and down and down, and you need to recover, then you need support for a while to get you back to an area that you can then, you know. And we do that with some frequency. You know, again, but it has to be, you know, someone has to sit down with you, one physician that says, okay, this is your problem. well, let's try this and see how it works, and very quickly, instead of seeing you a month or two later, decide what the next step is.
And it really helps once you get home to your, if you come all the way across the country to see one of you, it helps to find a congenial physician at home who will kind of go along with the program, because otherwise it seems like kind of a fight. And what I found was that I didn't need any chemo myself, systemic. So I thought, well, I'm going to a gastroenterologist because maybe he'll know about Dr. Sugarbaker and be a good physician to care for me. And for me, that worked. But yeah, you have to get a working relationship between your local docs and your expert surgeon too.